So unless I've missed anything, I'm going to hand over to Paul Rice, who's currently Director of Digital Transformation at NHS England and Improvement in the North Eastern Yorkshire. Paul will be really humble about this, but if it wasn't for him, we would not be here doing this. And he's got a super colleague, Lewis Palmer, who he's going to introduce to you. So if I can hand over to you now, Paul, that'd be great. Thank you.
Thanks, Louise, and welcome everybody. And as Louise said at the top, the history of this event was that we intended the event to be face to face in Leeds earlier on in the year, and obviously, with one thing and another, circumstances have changed, and we've moved to this online platform format. We do have some excellent support behind the scenes, but I can't pretend we're not a little bit nervous about how it might go over the course of this afternoon. So bear with us if there are any hiccups. I just wanted to talk to you a little bit about the background to the event, what we're going to focus on today, and perhaps a little bit about why you're looking at me as the anchor for the start of the event, when clearly a significant portion of our program over the course of today and tomorrow is about diversity and inclusion, but also specifically the challenges for Black and minority ethnic colleagues, partners and collaborators in the delivery of digital transformation in the NHS and society more broadly. I have to doff my hat very strongly to one of our sort of co-collaborator partners on this, on the Shiri Network. I had the privilege of attending an event in Leeds probably 18 months ago now, where the Shiri Network talked about where they had come from and the extent to which a group of women in tech from Black and minority ethnic backgrounds had looked across the faces of both audiences and panel members over a number of years in the sort of frequent events and contact points that we have around digital and healthcare, and hadn't seen enough colleagues representing their heritage, representing their experience, representing their backgrounds, either at the front of the room talking about the challenges and the opportunities around digital transformation, or in the audience, picking up on some of those lessons. So I was very keen as a follower of Three, as a fanboy of Caroline Criado Perez and her work on Invisible Women as well, that we started having real conversations about what is it about diversity and inclusion and the contribution that can make to better choices, better decisions, better conversations in relation to digital transformation. So what we'll hear over the next couple of days is some really inspirational contributions, I'm sure, from colleagues who've led on the digital transformation agenda from very many perspectives. One of the things that I just wanted to reflect, obviously, that has changed over the time from April, when we would have done this face to face till now, is clearly as a consequence of the re-emergence of the Black Lives Matter agenda, the murder of George Floyd, alongside the Me Too movement, that we really do have to ask ourselves about how we're building diversity into digital health. Are we having the right conversations with the right people, leading those conversations and contributing to those conversations? That challenge was emphasised even further in the early months of COVID-19, where it appeared that the virus was having a disproportionate impact on the experience of colleagues from Black and minority ethnic backgrounds, and maybe we didn't have the data points at our fingertips to understand that in greater detail. So again, if we're turning to the role of digital and technology in our lives and more broadly, it seems to me that we need to look at that through the lens of diversity and inclusion. And the final thing I would say in the context of my relationship with Agenda is the other thing that the Shiri Network introduced me to, which I think is really significant, is the importance of the concept of allyship. It's not that I will not be uncomfortable about some of the topics that we're going to cover in the next 2 days. It's not that I shouldn't be uncomfortable about those topics, and that indeed that senior leaders across the NHS shouldn't have some level and measure of discomfort about those conversations. We need to embrace that discomfort and actively do something about it to understand other people's experience, other people's contribution, other people's backgrounds, and why we need them actively in all the conversations that we're going to have about how we form and shape the health and care system, and how we form and shape digital and data's contribution to that. Having said that, and I hope set an appropriately serious tone, I don't want to set a solemn tone for the event. what I want to also do is respect and reflect on the massive contribution that colleagues from Black and minority ethnic backgrounds have made to the health and care system in this country over the last many years, and also particularly to the digital and data agenda. So to that end, I'd like to have the very great pleasure of introducing Lewis Palmer, a colleague who works in Ardash, a mental health and community provider in South Yorkshire, and his brother Reese, who are just going to tell you a little bit more about the roles that they currently undertake in the NHS in relation to digital and data, and equally significantly the multi-generational nature of the contribution that their family have made to health and care in the English NHS over the last number of decades. Lewis, can I just invite you to join us and share a few words before we run the video?
Yeah, thank you, Paul. Thank you for that introduction. So to introduce myself, my name is Lewis Palmer, and I work as a clinical studies officer, or a CSO, in the research team at Ardash. And so sort of my work has very much taken a focus around the health of the Black, Asian, and minority ethnic BAME community. And sort of coming from an Afro-Caribbean background myself, I make up that demographic that are impacted by COVID, and people from backgrounds like mine don't generally take part in research. So sort of recently I've been trying to focus on engaging the BAME community in research. So sort of our story is quite interesting. So I come from an NHS family. At the top of the tree, my great-grandma was a nurse. Her daughter Blanche, my nana, was an NHS nurse. My nana came over to the UK and with a few cousins from Trelawney in Jamaica back in 1957 as part of the Windrush generation to sort of start a new life over here for herself working in the NHS. So she had a daughter over here, my mum, Andrea, who's actually been working in the NHS as a nurse now for 35 years. And now, of course, myself and my younger brother, Reese, both now work for the NHS.
Yeah, sorry, I'm Reese, Lucy's brother, and I've worked at Ardash as an IT technician since January. It's my first job after finishing my level 3 extended diploma at college, which I did for 2 years. Yeah, just really enjoying it so far. So thank you for inviting us to this event as well.
So I think sort of overall our backgrounds fit quite nicely with the theme of these events that you've all worked so hard to run over these next couple of days. So we've got an Afro-Caribbean NHS family with Windrush roots. I think it's really important that we recognise the foundations that the NHS was built upon and the contributions of the Windrush generation, and that they've made both during the start of the NHS and also during these times of COVID now, when most of these groups are working sort of tirelessly despite themselves being scared and at risk of COVID-19. And so I've now actually got a video clip to play for you guys, which is starring me, my mum and my nana, and I hope you all enjoy it.
When did you start working at Ardash and why?
So I started working for Ardash straight after finishing my undergraduate neuroscience degree. So I wanted to work for the NHS, and I also wanted to work in a role that would sort of allow me to use my research experience from university and also gain patient contact. And I thought that a job in research was a perfect job for me. The NHS has been really, really important to sort of our family, and sort of near enough everyone in my family apart from my sister and my dad work in the NHS. I think it's good in terms of career development as well. I think we definitely need more representation within the NHS, and so people from Black and other minority and ethnic groups as well. I think it's really, really important. So it's good in terms of role models as well. So you can see other people sort of that look like you doing different roles to show that you can be a nurse or an OT or whatever you want to be in the NHS.
Why did you want to work in the NHS?
My mum has worked in the NHS, so I've been around and involved with the NHS through all my life really. I've been worked as a general nurse, worked as a midwife. I'm now in a practice nurse environment, so I've seen it from all angles. So it is a good place to work, good job prospects as well. So I would encourage anybody, whatever minority, to join the NHS.
Why do you love working as a nurse, and what makes your day?
There's lots of little things. As a midwife, it's obviously delivering babies, that sort of thing. As a practice nurse, it's just the general public really, the thanks you get, it's nice.
What would you say to somebody who's considering a career in the NHS?
Yeah, I'd encourage anybody to join the NHS. There's lots of different jobs you can do besides nursing, but to be involved in that would be really important, and lots of ethnic minorities involved in there would be helpful as well to progress and be at high levels. And yeah.
Well, I just tell them I've been in the NHS all my years. You know, yes, I got a job about a year, a couple of months after I came over here. All sorts. I've done on wards, theatre, A&E. I've done industrial nursing in factories, factory nurse. And I've worked in healthcare, you know, clinic for women and men.
Gynae, colposcopy.
Yeah, that's my baby. And but it depends what you like, you know. What if you like the ward work, you know, you can settle in the ward work. That's it. But when I left here in Doncaster, I went into Sheffield, worked in Sheffield for 6 months, women's health, and I did the same in Rotherham, a year I think it was. And then I went to Leeds and did a couple of years there before retiring.
You've actually worked here, haven't you, Mum?
Yes,
You did.
yes.
Particular
I worked in Elm Ward. So I was based in Elm. I ran Elm Ward for years. Yeah. It was the old ward then, you know.
Was that when you were 18 when it was qualified?
Yeah. So taking in Leeds.
That's the one she
Oh,
came
wow.
That's
over.
what hey, there's a little date on it. 4th of April 1959.
So I'd just like to say thank you to my nana and people from the Windrush generation as well, and we've all sort of helped and contributed and made the NHS what it is today.
Thank you, Lewis and Reese. That was great. I've seen that about 10 times and I still get a little bit emotional. So thank you. That was really super. And thanks, Paul, for that sort of great introduction to the whole event.